So we call those floaters, and they're very common. And generally they're just little bits of debris, maybe solid particles of jelly floating through the liquid jelly inside your eye. So the jelly that fills your eye is called vitreous gel, and it naturally changes as we get older. And sometimes those little solid particles, you'll see them as the light comes into your eye, it hits those solid particles and you see a shadow of them. And that's what we call a floater. And sometimes they can be little lines, almost like cobwebs. Sometimes they're little dots, and even clumps that can look like a little spider or something just out of the corner of your eye that you know isn't really there. So they're not dangerous. Floaters are very normal. Lots and lots of patients will say they've had them, they've noticed them for years, but if they're new, then we need to know about it. And most of the time, there's still nothing to worry about, but there's a couple of things we want to rule out. So floaters are generally little bits of debris that are just a natural aging part of the eye, but sometimes they can be a sign of high blood pressure. Sometimes they can be a sign that the jelly itself, so the vitreous gel, has come away from its attachment at the back of the eye, and we call that a posterior vitreous detachment. And again, in that case, you don't actually need to worry about it, but there's maybe a little bit of lifestyle advice we would give you just to protect the eye. And then finally, the most important thing that we do want to rule out, it's quite rare, but it's a retinal detachment, and that's where the nerve layer at the back of the eye that we call the retina, where it can come away, it tears and can come away, and that does leave you at risk of sight loss. So it's something we want to find out about and treat and refer in a timely fashion. If the floaters are new, we'll often ask you, have you had any flashing lights as well? And the reason for that is if the jelly has come away or the retina has come away, you get tugging on the retinal, the nerve layer at the back of your eye, and you can see that as flashing lights. And those might be like a dart of light out to the corner of your vision, or even an arc of light sort of arcing around the side of your vision. So if you see some flashes of light, you turn and they're not there, and you can even experience those with your eyes shut. That might be a sign that there's some tension or pulling on the nerve layer at the back of your eye, and that's sending a little signal to your brain to tell you that there's light flashing when in fact there isn't. So PVD, posterior vitreous detachment, simply means that at the back of the eye, the jelly has come away or detached. There's an area at the back of the eye around the disc where the jelly is most firmly attached, and often that's where the jelly will tear away, and it creates a very specific floater called a vice ring, and you'll see it almost like a clump or a little black clump of something or a little fly in your vision, and that's one of the very specific types of floaters called a vice ring. So again, having a floater is very common, and having a PVD is also very common, and in most cases it is not dangerous, but often we'll give you some advice about how to protect your eye. If the jelly has come away, sometimes it can be tugging, so it can leave a little bit of tension between the jelly and the retina, and it can be tugging on the retina, and we want to just make sure that that doesn't then lead to a retinal tear. So a retinal tear is when you get a tear of the nerve layer at the back of the eye, and the nerve layer can then detach and come away, and you may have heard of it called a retinal detachment. And that's obviously quite serious. It can cause loss of sight, and so it needs to be picked up and treated really in a timely manner. And so what we're looking for with that, often you'll get suddenly new floaters, so it's not the odd floater that you'd see on a bright day, but rather it's sudden onset, lots of new floaters, or a very large specific new floater. And that can also be associated with flashing lights. So you might notice a little dart of light out of the corner of your eye, or even an arc of light, and when you turn to look at it, it's not there. And you might even notice those flashing lights when your eyes are closed, when you lie down in bed at night. And those are things that we would want to immediately check out. So we would see you in the practice on the same day to dilate your eye, to look right out to the extreme periphery, and to check that the retina is intact and healthy. Another question your optician will ask is, have you noticed any shadows or a veil or a curtain coming down over your vision? Because as the retina, if there is a retinal tear, as the retina comes away, then it creates like a shadow in your vision, and often it's in a portion, so you'll see a shadow in a certain area where the retina has detached. It's highly unlikely. The restorative surgeries now available are so successful. So if you have floaters, we want to make sure to protect the back of the eye and to minimise the risk of the jelly coming away and the retina tearing. And so simple things like your posture when you're hoovering or gardening or doing anything where there's any effort, you want to ensure that your head is sitting level rather than leaning forward. The same things that would see if your back, so if you keep your back straight and bend down using your legs, that will keep your head in this position. Whereas if you're lifting with your head down, you're more at risk of causing difficulties to the back of the eyes. So if you notice new floaters, it may simply be that it's a bright day and you're looking at a white background. And often floaters that you see from time to time are more obvious on a bright day or on a plain background simply because it's the shadow you're seeing. So if the floater is new or a very large one, or you've suddenly noticed flashing lights or maybe a shadow in your vision, then we would want to see you that same day. So contact the practice straight away.